So we're going to talk about today how to access a portacath. And you can see if you first want to start off with gathering your equipment that you're going to need to have at your patient's bedside, which is the actual dressing kit, BioPatch, your needle, the 10 ml normal saline syringe and a needle, and then the cap to put on the end of the Huber needle. And then, but before you access your patient's portacath, you're going to want to make sure that the patient and the parent of the patient is aware of the process that's going to happen. And you're going to want to wash your hands really well. And you're going to want to palpate for the port before you put on your sterile gloves. You're going to put a mask on the patient, and you're also going to wear a mask. You're going to open up, now we're going to get ready to get all set up. You're going to have to open up your central line kit, and that is where you will get your mask and your sterile gloves from. And you're going to use the packaging of the central line dressing kit as your sterile field as well. So you can, again, before you put on your sterile gloves, then you're going to open up the packaging of all of your sterile equipment to drop onto your central line kit. And now you're going to be ready to access your patient. So what we're going to do, I'm going to kind of walk you through the demonstration of how you would access a portacath. So first we're going to open up your central line kit. I'm going to move this stuff so I'm not reaching over my central sterile field. And here's my mask that I'm going to wear. And I'm going to move the gloves to the side so then I can drop all of the rest of my equipment onto the sterile field. Here's the BioPatch, the end cap, and the needle. Put on one of my sterile gloves first, so then that way I can then hold my needle and still keep that sterile. Draw up your saline. While all still maintaining your sterile field. And since this is still sterile, I can put this over here and discard your needle that you no longer need. And now I can put my other glove on. All right, and I'm not going to be using a real patient. I'm going to be using the teaching book for the portacaths. So once I palpate, again, the skin of the patient around the port to find the port, this hand is no longer sterile, so I will not be able to touch anything else. So you can see the 3 dots around the port to know that that's where the septum is. So that's how you know where your port is. So then you're going to take your chlorhexidine swab, and you're going to make sure you clean really well all around the port. And then you're going to have to let that, once you're done cleaning, you have to let this sit for 30 seconds to dry. And now All right, and you're gonna prime your tubing with saline first, okay? Now it's been 30 seconds for this to dry, so you're gonna take you take the cap off, hold down the skin so you can see the 3 dots that form a triangle, and you're just gonna come at a 90-degree angle and push it in, and then you'll feel the metal behind, and then you would flush the saline in and draw back to make sure you get good blood return. And now that it's accessed, you're going to, well, you're going to put your, there's my bio patch. You're going to put your bio patch on, and blue side is up. So you'll slide it right underneath. So that goes underneath, and then you would put your sterile, transparent dressing on top. And that's it. Now you're accessed. So then you can untake your mask off and remove your gloves. Now we're going to talk about the reasons why you would need to have a portacath access. Most of these patients have chronic conditions who would require multiple infusions over a lengthy period of time, or also a very difficult stick. So like your chemotherapy patients, sickle cell patients who maybe require monthly blood transfusions, or just a few. And some special considerations would be doing with your age population. For mostly with kids, you're going to want to numb up the area so they can actually go home with Emla cream to put on over type of their portacath site, come in, and then the nursing will wipe the cream off before they access it, and that keeps the skin nice and numb, and they don't feel the puncture of the needle. Nursing has to remember that if it's a gauze is underneath the sterile dressing, that has to be changed every 48 hours. Otherwise, it has to be changed on a weekly basis, and so is the needle. Common mistakes are people forgetting to use the bio patch. You don't have to use the bio patch if it's just going to be a quick infusion and then you're going to be de-accessed. But if it's going to stay in over a 24-hour period, you need to have a bio patch on. And you want to make sure you're doing appropriate flushing, whether it's with saline or with heparin. People tend to forget you have to have heparin flushes at least once a day. And with CT scans, certain needles are not compatible to the power injectors that are used for CT scans. And some complications, obviously, with portacaths are increased risk of infection because you have a needle, going through your skin. Infiltration, sepsis, skin breakdown from around the site, especially if it's accessed for longer periods of time, because the constant taking of the dressing on and off can break down your skin. And the portacath itself can break inside of you. So that's why you need to make sure you're checking for blood return and flushing appropriately. And that's it. Thank you.